Hey, let's talk about a question that I've gotten recently, which is, can nurses have colored hair? Hey everybody, this is Thomas from nursemoneytalk.com, where I help nursing students become nurses and nurses excel in their nurse career and nurse life. And let's talk about colored hair because it's kind of it's something that has a lot of variability and just it really depends a lot. I will begin this with how I typically begin answering questions like this, which is if this is something that's important to you, then before you accept a job or when you're applying, it's real, you should really consider making sure to ask the right questions, find out who you can ask to make sure that you do know what the facility's policy is on, in the case of this video, specifically colored hair. And when I say colored hair, like just assume that we're talking about hair that would be like an unnatural hair color. And because when you're looking at this particular question, it really just kind of depends. I think the landscape is changing a bit. Like I think that, there might have been a point where it would have been unheard of to have a facility where staff have, dyed their hair color, pink, blue, purple, whatever. And, similar to how, at one point it probably would have been unnatural to see people who have exposed piercings and, that's not the ear or tattoos or anything like that. But the landscape is changing for that. And as for me, I've been at places where they would have taken great issues with colored hair or hair an unnatural hair color, and some places where they wouldn't care. One place where I'm working at now, we just the other day, one of the techs came in and hair color was pink for that day. I've seen this particular tech at some point or another with purple hair color. So, that particular facility doesn't care. To be honest, actually, now I'm thinking about it, to be honest, I'm not sure if it's they don't care. I mean, if it's there's no policy against it, or if there is a policy against it and they just don't care to enforce it. So, but I do think that's probably, now that I mention that is probably something worth mentioning, is that it's important to see what's actually written, because if it says no, hair has to be, a natural hair color, and they're just not enforcing it. There's, who's to say that they wouldn't wake up one day or an admin change or whatever, and then they start enforcing it. So that's something to kind of keep in mind. Now, as for real quick, for the nursing students, I think there's probably going to be some variability as well with this. Most of the schools that I am familiar with, they probably would take issues with, I think the school I went to, and some of the others, for sure I know, they would have taken issues with it. Some of the other schools that I'm thinking of, I'm pretty sure they would take issues with it as well. I think in general, students probably have less leeway, less wiggle room with something like this, because the schools, especially for trying to get these clinical spots and trying to represent themselves, they're always trying to go for this professional appearance. So if you're a nursing student or you're about to be a nursing student and you normally dye your hair whatever color, green, blue, purple, whatever, then it might be worth it to you to just double check with the institution. Remember, always double checking, make sure you actually know what's actually in the rule book, because there is, like I said, these schools, they're always pushing for, especially since they don't want to lose their clinical spots either, they're always pushing for this professional appearance. And then that kind of gets me into this: if your school or workplace allows you to dye your hair color whatever you want, yellow or pink or whatever, should you? when it comes to that, I think you just kind of have to, ask yourself that question, because, the thing about it is that I think professionalism, or what people deem to be professional, is a real thing. Now, with that said, whether or not you should care or shouldn't care, or how much you should care, I mean, I don't know. I think that's probably a personal choice. But you do have to kind of recognize that there is such a thing as professionalism, and that what people deem as being professional it's probably gonna vary. One person might see somebody that has, I don't know, like a nose piercing as, oh, you have a nose piercing to work. They might deem it as being unprofessional. Somebody else might look at it and just see, either they might think, oh wait, that's pretty cool, or they might even look at it and not even think much about it. They might take note about it, and they might not think, they might not even think anything about it. And so I think that is, though, something to keep in mind, especially when it comes to dealing with patients and getting a job, honestly. Like, if you're going to, if you're dealing with patients, an older patients might not necessarily find that professional. I'm not saying it's a given, but they might not think you're as, that you're professional just because you have your hair color dyed yellow. And if it's looking for a job interview, depending on who's interviewing you, even if there's no rule in place that says that you can't have your hair dyed yellow or whatever at work, that doesn't necessarily mean that the person interviewing you won't hold it against you. I'm not here to say it's right or it's wrong. That's not the point of this. The point of it just being that they could hold it against you. So for sure, going into an interview, I think that's probably something to keep in mind as well. But I think that is a separate, that's a separate conversation, a separate topic on interviews and how to dress and whatnot. And I'll put the link to those on how to interview for a nursing job in the descriptions below. I think that's really all I've got for this. And I just want to know, like, let me know in the comments, what are your thoughts on just like nurses having their hair, dyed, yellow, blue, whatever, like an unnatural color. Like, would you look at that nurse and think they were, not as professional or whatever? I'm just kind of curious what your thoughts might be on that. So let me know in the comment sections below. If you found this video helpful, don't forget to hit that thumbs up and that subscribe button, and I will catch you very soon in that next video.